The Johnson & Johnson vaccine is designed with a non-replicating adenovirus vector. So that's a DNA vaccine, but it delivers the exact same thing as the mRNA vaccines from Pfizer and Moderna, which is it's the genetic code for our own bodies to manufacture the spike protein, and then we have an immune response against that spike protein, which makes us immune to infection. The vaccine has less stringent cold storage requirements, and so that means it's more likely to be available at doctors' offices and certainly in rural areas of Northern California that may have limited ultra cold freezer capacity. So that's good news for more availability. And the other main difference is it's just one dose. So the other two vaccines are two-dose series, either 3 or 4 weeks apart. So one dose makes it that much simpler to get everybody vaccinated. So I wouldn't focus in on the efficacy numbers. That's just a point estimate. And if you look at those numbers and the statistics, it's not statistically different from the other numbers from the Pfizer and Moderna vaccines. And also remember that we're comparing apples and oranges because these vaccines were studied at different time periods, in different populations, in different geographic locations, with different circulating strains. And so therefore you can't really compare the two. All three vaccines are highly effective, and I would have no qualms about taking any one of them. I don't have a preference for any of the vaccines. And the CDC specifically has said they don't have any preference for any of the vaccines. All three vaccines have very similar side effect profile. There's one difference, which is since this is just a one-dose vaccine, you're only going to have those side effects after the first dose and not after the second dose as with the other vaccines. We know we still don't have enough vaccines available to vaccinate everybody that we would like to. So having more vaccines, more vaccine manufacturers mean that we're going to have a more steady supply of vaccine and more vaccine availability. We'll be able to vaccinate more people, get immunity sooner, and then we'll all be able to have decreased risk of transmission in the community and open up sooner.